So on today in medicine, health and medicine, we will continue seeing about coronary artery disease, and we're going to see about some things that help, or actually, some things that make easier for those diseases to happen. We have some things that are not modifiable. For example, age. For females that are more than 55 years old, it's easier to have these diseases. And for men, is for more than 45 years. And it happens due to chronic plaque buildup until that point. And men are more prone to eat um, fat fatty things, and they oftentimes uh, don't take the doctor's advices. So that's why it's easier for men to have these coronary diseases. Also, yeah, the sex. Males at higher they have higher risks because they have 10 years less. They begin with 45 years old to be in that risk, right? Because they have because women have higher amount of estrogen. It means that they have better cholesterol cholesterol profile. Also, family history. You cannot change your family history, and can share possibly share genetics for heart health. It happens on heart diseases and on cancers also happen, and also ethnicities. For example, African, they are more prone to have hypertension, leading to coronary artery diseases. But we do have some things that are more defiable. For example, diabetes. It's bad eating things with excess glucose because it's going to damage the artery walls and will create plaques. So if you have diabetes, you can stop. Actually, you cannot eat sugar, right? And so that helps. It's again against these diseases. Also, physical activity lowers risk of disease, so you get better glucose. Um, the LDL is the bad cholesterol, so less LDL, less fats, and also uh, when you exercise, you have more beats per minute. And if you don't smoke cigarettes, it's also very good. Uh, so when you have high levels of LDL, you it's going to deposit on the arteries, and that's going to damage the blood vessel walls and form plaques. Also, when you ingest lots of triglycerides and fats, it will indirectly increase the plaque formation. Also, hypertension when you have a high BPM, right, high beats, right? And when the blood is has lots of pressure, it's going to damage the wall. So when you do physical activity, you kind of regulate it. And when you regulate it, less pressure, right? And also cigarette smoking is very bad because the toxins they damage the walls and then the plaques form, and you know it. It's very bad. It's cigarette, so you should avoid it. And so yeah, those are the in a nutshell the causes of these diseases, the coronary artery diseases.